Hi, I'm Dr. Starsiak at the Starsiak Osteopathic Clinic, and I want to talk to you today about osteopathic philosophy. There's a concept that the founder of osteopathy shared, and this was that the osteopath's job is not to find disease, but to find health. So when we're talking about body work, we can divide it into two main categories, and then within those categories, we can make more distinctions. And we can even talk about the point in between those two categories. One category, which most people are familiar with already, is called direct. So direct techniques are techniques where the practitioner is actively trying to take the patient through their restrictive barrier. So we can see this in body work, right? We can see this, people do this in relationships, where if, say, my wife is afraid of spiders, and sometimes I find myself trying to get her to desensitize. This is a very common knee-jerk strategy that is it's the lowest level. It's the very beginning of trying to help somebody with some sort of restriction. We can see this in psychotherapy, where there's some psychotherapists that are much more direct, and they just tell someone to get over it or go out and do something. So within body work, one of the best known techniques that is a direct technique is the popping technique that chiropractics have become famous for. Now, this technique was present within osteopathy before chiropractics was even talked about. Actually, the founder of chiropractics came and learned like a few-day course from the founder of osteopathy. And at the time, a full osteopathic degree took 1 year. Now it takes 4 years for school, and then at least 1 more year in most states to become licensed. A few states 2 more years, but most people go on and get a full residency. And so that's a minimum of 3 years. But back then it was 1 year. So the founder of chiropractics, he didn't want to go through the full training. He took a few-day course, and then a few years later, he did his first chiropractic treatment and talked about it. And later he also acknowledged in writing that this osteopathic course made all the difference for him. But what's interesting is he did exactly what the founder of osteopathy recommended against, and that's chasing the pop. That is to try to get these articular pops out of the joints. Now that's not to say that that technique has no benefit, because there's plenty of people out there who've experienced benefit from that technique. In my practice, what I see is when that technique is applied correctly, meaning there's an intelligent diagnosis, selection of the joint to be mobilized, and mobilization into the direction of restriction, that you can get 80% improvement for years or for the rest of the person's life. Even when it's perfectly selected and it's done perfectly, there's still usually about 20% of cleanup left. Now, people are happy to get the 80% gone, and they're not going to complain about that 20% generally. So it's not that big of a deal. When it's not used well, what ends up happening is it's this sort of situations where the practitioner wants you to be in a membership, where they plan for you to come back once a week, or they plan for you to need it once a month, or even some places want you to come in every 3 days. So when the dysfunction is recreating itself so immediately, what that means is that the technique is not matched to the dysfunction. Now, there are other direct techniques as well. There is direct myofascial release. This is like stretching. You can stretch yourself, or if you have someone else doing it for you, they can achieve something a little different than you can achieve on yourself. But it's basically engaging the barrier of motion and then sitting up against it, and then gradually trying to take more length. And that way we can get fascia that has become constricted, and then the sheets that are supposed to glide over each other, when they begin to get cross-linking in them between those sheets, then they won't have as much range. So when we're doing direct myofascial release, when it's done to its fullest extent, it tends to be very uncomfortable, and it'll even feel like there are little teeny bits of glass breaking inside. Right? That's some of the best results come after that. And this technique was really well developed by Ida Rolf. So she saw an osteopath, and then she went ahead afterwards and started studying anatomy deeply and developed a whole series based on just direct myofascial reliefs. And that's known as Rolfing commonly, or structural integration. There's two schools, and one school ends up actually leaning more towards indirect myofascial release, even though they don't explain it that way most of the time. And the other school is still doing what Ida Rolf taught, which is the direct myofascial release. But those are two sides of the same coin. We're not going to talk about indirect yet. But there's another type of direct technique in osteopathy. We call it muscle energy, where we take a muscle to its end range of motion, just the feather edge of its restriction, right when it begins to have resistance to more motion. And then we can contract that muscle while holding the joint still, hold it for a few seconds, let it relax, and then in the relaxation phase, it can be lengthened a little bit. So this has been brought on by physical therapists. This has been taught by DOs to physical therapists. You even see this in some people that are just doing stretching, that don't necessarily have a particular degree, but are stretching people for them. It's a pretty easy technique to do the first 50%, but when we get into the specificity of using it for, say, cervical joints, or when we want to get a really deep treatment result as opposed to just stretching, but where we're getting a sort of neurologic reflex, we're engaging the traumatic response when the contraction phase is being held. That takes a lot of sensitivity and specificity. So that technique can really be developed to a tremendous extent. And then inhibition is also generally counted into the direct technique category. So inhibition is where you have a muscle tender point or trigger point, either active or latent. Active trigger point, you have pain going into a particular pattern, a distribution, and then you press on a kind of dense band in the muscle and it'll shoot the pain through that same pattern. A latent trigger point is when you find one of those dense muscle bands, but there's not an active pain pattern until you press on it, and then it shoots through a distribution. And then tender points, those are just points where when you press on them, they're tender. They don't shoot through a distribution. And they all have tissue texture change to them. They're dense. So inhibition is where we press on those spots with gradually more force. So the gradual increase in force makes it more comfortable. If we use the full amount of force from the beginning, it's intolerable. And how that technique works is it deprives the muscle of oxygen because of the pressure. The vascular system can't overcome that pressure. And so carbon dioxide builds up. And carbon dioxide is a vasodilator and a muscle relaxant. So then it causes it to let go. So when the practitioner feels that let go, then they'll release the pressure on it. Now, direct techniques can also be used with balanced ligamentous tension as well. So the concept of balanced ligamentous tension is that before an injury, any joint is always in a balance of ligamentous tension, whatever position it's in, that there's this reciprocal tension that guides the motion of the joint. And then after an injury, some elements are loosened, like say you sprain an ankle, the outer ligaments are loosened, and then some are braced. And that's because ligaments and fascia, they're innervated and they have a little bit of actin and myosin. So they have the ability to ratchet a little bit. There's been some research into this, and this dynamic is needed to explain how power lifters can lift as much weight as they do. It's the ratcheting effect of the fascia that explains this. Otherwise, there's a problem arises with the calculations where you can't really account for how much can be lifted. So in that, one can directly work with that sort of restriction. It takes a lot of sensitivity to engage the traumatic response. So if we're doing direct work intelligently, we're not thinking about it just as working with sort of a dead structure. Like, oh, this thing happened and it's a lifeless thing that I need to break apart. That idea of breaking things apart is also one of the really low-level concepts. And a good analogy to understand how that's just not a very functional idea is if you think about a child who's having behavioral issues. You don't just want to break apart his relationships. You don't just want to break him out of the situation that is associated with his bad behavior. Like if his parents have some addiction issues, or there's some instability at home, or there's abuse, or there's whatever. It's not like you just want to break him free and put him on the streets, because that's going to cause problems in and of itself. You want to find a greater integration and harmony within systems. You want to find that balance. We'll talk a little bit more about, where does that balance come from? What sustains that balance? And what is the integrating force? We call that the health, but I'll get to that when we're talking about indirect techniques. So with the balanced ligamentous tension techniques, also known as articular ligamentous strain, we can feel for what exactly is the direction the ligaments don't want to move, and then very particularly introduce that vector with tremendous patience, like a glacier. Glacier is moving very slowly, but it's going to even everything out. So anybody that's rushing in body work, they're going to tend to have to stay fairly superficial. If you want to make a positive difference in the body, you first need to blend with the tissues. Just like if you wanted to make a positive difference in a community, you first need to understand the community. They need to like you. They need to see you as actually caring about them. You need to be blended into that community, not holding yourself apart. Right? If you come in and you try to change something, but you don't know anything about that community, well, you're going to get thrown out. People are going to resent you. They're not going to like it. You're going to look arrogant. So the same sort of thing is true with treating the body. The first step is always listening, whether it's direct or indirect. And like in war, the degree of the intelligence we have about the situation determines how successful we can be. We can have all of the amazing implements of war, the tanks and the guns and the bombers and all that, but if we don't have the intelligence, it's very useful. Intelligence will defeat it every time, and we've seen that in history. So whether we're doing indirect or direct, we're listening deeply. And with direct balanced ligamentous tension technique, right, it's just that gradual engagement into the direction that it doesn't want to go, but being very patient and waiting for that traumatic holding to release. So that's part of it. There is the contracture that can occur in the fascia from a position that's stuck for a long time, and that's sort of like a dead, like a lifeless, just structural thing. But then there's also the nervous system that's bracing the region. And that's really what we want to have the dialogue with. Once that lets go, then the just structural elements will actually free up on their own. And this is a phenomena that happens very commonly in indirect techniques. So indirect techniques are very surprising to patients, especially like big muscly men. Because most people think you have to treat things directly. You have to oppose the restriction. You have to take things where they don't want to go, and it's going to hurt, and it's going to be difficult, and there's going to be a struggle, and the practitioner is going to put a lot of effort in. There's going to be a lot of moving around and straining and such. With indirect, we are not doing any of that. And there is an argument to say that what I'm about to describe as indirect is actually the point between direct and indirect. Because instead of finding where the structure doesn't want to go, what we do is we find exactly where it balances, exactly where it wants to go. So if I had some things pulling on me, if I had, say, bungee cords and they're hooked into me and they're pulling me in different directions, there will be one position where all of the tension on those cords will equalize. So if this one, say, has more tension than this one over here, if I move this way, this tension will decrease and this tension will increase. And there'll be a point where they're matched. So then this would be what we call ligamentous balance or neutral, or the wobble point or the balance point, or you've heard it called as like zero balancing. There's all these different terms. A still point is sometimes what it's called. We can use a still point to describe different phenomena, not just this. It's that position of reciprocal balance where the treatment begins. And the reason is because before that is achieved, it's like the proprioceptors, the neural elements, the sensors all over our body that tell us where we are in space. It's like they can't see clearly what's going on because the tension that's on them is making it blurry. When the practitioner reestablishes balanced ligamentous fascial tension, it's like the proprioceptors can suddenly see, and everything lines up, and the central nervous system does this double take. Like, hey, what's going on here? Balanced ligamentous tension is being achieved in this position? That's not right. And then something happens that then causes a release, and then a rebalancing occurs. So for the practitioner, the force that we were balancing that brought us into a particular position will just fall out from underneath our feet like shifting sands. And then the structure wants to move back towards neutral. So in indirect technique, there really is no struggle. There's no attempt to break apart some sort of adhesions. But what will happen when we get really deep treatments and we get this to rebalance on this subtle, deep level, people can be profoundly sore. Not always. It doesn't seem to need to happen all the time, but people who are really sort of bound and stiff, these tend to be guys who do a lot of physical, heavy labor stuff, they're always so surprised because it feels like the practitioner is not doing anything, because we don't have to provide a big positional change in order to balance tension. We can get a major positional change and not really have balanced tension at all. The imbalance occurs in these subtle motions, and that ease is achieved with ease, actually. It's very easy to balance them. So he talked about, I briefly alluded to the health earlier, then I talk about that more in indirect. So the health is this concept to explain our self-maintaining, self-healing activity in the body. So if we think about the unfolding of the embryo, right, that is an expression of the health. And there are different things that can be an insult to the health in that process, right? You get certain molecules in the mother's bloodstream that pass through to the placenta, and you can totally disrupt that beautiful dance. You can totally desynchronize it. And then there's also a genetic component, of course, as well, where the genes, it's not like they're a blueprint for building a house. It's more like they're a set of instructions for responding to the environment. And the environment and the DNA together, they're really, this is a term I've coined, which I love, is they're riding the wave of what's possible, right? Life is coming out of this possibility just based on all of the, the matter, the atoms, and how those all interact and work. In them, there is this possibility of life, and it's like DNA is this amazing technology that rides this wave of possibility and allows life to occur. So every moment, things are synchronized and they're working together. So the health is our concept of what's taking care of this. And the health is really unimaginable. It's sort of beyond conceptualization. So as osteopaths, we'll talk about it coming from the horizon. So coming from the place beyond our ability to intellectually grasp it. And this makes sense because it's what allows our intellectual mind to exist. It's what allows this whole shebang to be going on. So the idea that we could grasp it fully intellectually would kind of be like thinking that I could swallow the Pacific Ocean in one gulp. It's not possible. But what's so cool about osteopathy is that we recognize this mystery. It's one of the big distinctions between osteopathy and the MD world. The MD world, kind of officially, it seems the sense is everything is able to be solved intellectually. It's just a matter of time. But within osteopathy, there is this clear understanding and really enshrining of this central sacred mystery that we can never fully define, and that escapes all of our attempts at being dogmatic or rigid and will surprise us over and over. So when we're treating, when we're helping to rebalance the structure, we're actually allying with that force. So we're blending with these inherent motions. And this is another big distinction between osteopathy and other approaches. Unless these other approaches came from osteopathy, like craniosacral therapy or orthobionomy or Rolfing. But The difference is that we're not feeling like it's all on our shoulders, but that we're actually working with the health. And so the health will integrate into the body. And then there's different manifestations of it, we could say. The respiratory rate, we call the cranial rhythmic impulse, which is synchronous with this autonomic phenomena called the Mayer wave. And these inherent motions, they integrate the structure. There's even slower inherent motions than the one that I've mentioned. And it's as if when someone is treating, it's not like it's coming from us. It's like the treatment comes from everywhere. It can come from all around. And so we're not getting a hold of it and making it happen. What we're doing is we're really joining a natural process that's already trying to, say, get over the hill, right? It's kind of like like the body's trying to roll a boulder over a hill to get to a place of stability, but it needs a little bit of help. And so that's the role in the osteopath, is we reestablish this balance externally, and then the body can see clearly what went wrong, and then the inherent forces, they can actually reintegrate the structures and bring them back to this greater level of fluidity. So what most osteopaths, what we're doing is we're climbing this ladder of subtlety, and we're getting these more and more effective levers that are more and more subtle. And they're more effective because they go deeper. So I talked about this concept of ligamentous balance with the tensions on each side. And if this has more force pulling on me and this has less, well, if I give to it, then this is going to develop more force, and then this is going to have less, so I can find balance. If we follow that feel of tissue tension differences, we can actually get to this point of fluid balance, where now we're not even distinguishing individual tissues, but the body begins to feel like a fluid whole. And then that becomes what we're tuning to. We're tuning to the fluid whole of the body. And then that fluid whole of the body also stops having a distinct end feel like in the body or around the body. The natural state is that a body feels like it expands out, and there's not an end to it expanding out. We could say it expands out to the horizon. And this is language that comes from the biodynamics of osteopathy in the cranial field. This work done by James Jealous, building on all of the osteopaths that came before, drawing from Bleshmitt's work on embryology, as well as a lot of other things, and a very rich life of experience. And it's the system that I found to be the single most effective system. So if you're an osteopath and you're watching this, take those courses. There's 10 phases, 10 core phases. Definitely take them, do one a year, and then just work with it in your practice in between. If you're a potential patient watching this, they have a directory. If you look up James Jealous, Biodynamics, Physician Directory, and that's a good place to start to find someone in your area. But what's so cool is that in osteopathy, there's this very sincere work to understand deeper and deeper, and a willingness to let go of any preconceived notions and just to sit down in front of fact and let that fact take us wherever it goes. And it's baked into every part of treatment. And when we begin, we don't start with an agenda. We start with a clean slate, a tabula rasa. And then we see what comes out of that. By starting, as I open this conversation, by starting to look for the health, the footprints of the health in the body, the inherent motion, the flow, the fluidity, and finding that fluidity, relating with it, tuning it to like blending with it, and then helping it go into ease so it optimizes, so it becomes augmented. And then what it's going to show us is the areas that it can't go. So we don't have to worry about looking for a disease or for the problem, because the health is going to just serve us up on a platter the area it's having trouble integrating. And then we simply just tune it to the health so that it can flow through it. And there's like a potency to the health, like if you had a hose and you crimped it, and you could feel that it wants to come back out. So when we're working with it, that's kind of like what it feels like. Another great analogy is a finger trap, right? You try to pull your fingers out and more bind develops, but you disengage by pushing in, and then you can remove your fingers without effort. So it's a really beautiful work, and osteopaths who are very sincere about this work and don't see the manual work as another tool in their tool belt, but they see it as the main trunk for the rest of their practice, they tend to be able to get these results that are surprising. And they tend to be able to help things start moving that historically haven't moved before, where there hasn't been any progress, or progress is kind of halting and then there's regression. So I can't encourage you enough, if you're not in the Indianapolis area, to seek out an osteopath in your area. Make sure you look at reviews and everything, because there's great ones, there's bad ones, and then there's a bunch of okay ones. And so you want to either get one of the okay ones or one of the great ones. So just because the tradition and the history within osteopathy and the principles and approach are fantastic, it doesn't mean everyone fully got them. But if you're in the Indianapolis area or in a surrounding state, you can totally come and see me, be a patient of mine. Just follow the URL that's associated with whatever account you're watching this on, whether it's Instagram or YouTube, and you'll find the phone number and you can make an appointment. Thank you for taking the time to listen to this. I hope you found it informative, and I look forward to the possibility of seeing you in the office.